Please join me in welcoming James Olsen and Jill Vermeire.
Can everybody hear me? I apologize if my voice gets a little raspy this morning. I had the flu a week ago, and my throat hasn't recovered, so I promise I'm not contagious. So, as a brief introduction to us, can I have the therapists in the room raise their hands? Okay, a few therapists, and I believe we have one sex offender treatment provider. Is that true? All right, that's what I thought. And attorneys. All right, God bless you. All right, one more time. Who here in their regular daily, weekly practice or professional practice frequently deals with sexual behavior? About half. Okay, that's a good starting point here. Apologize here. There we go. Oops. There we go. All right. So let's start. What does it mean to be sexually deviant? I want to make this as conversational as possible this morning. So what do you guys think when somebody says sexual deviant? What are the words, the imagery that comes to your mind when somebody says sexual deviant? Go ahead.
Harming other people.
Harming other people. Okay, good. That's a good one. What else? Force. Okay. Any loaded language you can come up with?
Pervert.
Pervert, thank you.
Kink.
Kink, yes. Keep going.
Fetish.
Fetish, okay. Good.
Predator.
Predator. I was looking for that one. Thank you.
Rape.
Rape. Absolutely. And these are all words that we have tied to the term sexual deviance. The ones I came up with: pervert, predator, offender, rapist. You guys did great. So, what exactly does it actually mean to be sexually deviant? I mean, somebody has to have a definition. We use this terminology all the time. It's used in certain professional circles. I think it's really important for us to consider what do we actually mean when we use the term, and then analyze that and decide whether or not it's particularly useful or not. So, Jill's going to read this for us real quick.
Although we're not huge fans of just reading PowerPoints, we're going to read this to you because it's pertinent. Sexual deviance, and what is defined as sexually deviant, is culturally and historically specific. This concept refers to behaviors that involve individuals seeking erotic gratification through means that are considered odd, different, or unacceptable to either most or influential persons in one's community. As with most forms of deviance, sexual deviance is something that is defined differently by persons of different backgrounds, beliefs, morals, and locations. And I'm not even going to try and say his last name.
It's okay. Okay, so let's try and tear this apart. At first glance, does this seem profoundly useful? Why?
It's not specific.
It's not specific. It changes by different groups and times, and it's just it just ebbs and flows with the wind. There's no way to nail it down and to actually talk about specifically what we're meaning. And if you think about it, it's almost obvious. The term deviant, if you just look it up in Webster's dictionary, what does it mean to be deviant? To deviate from the group, from the norm. Well, that's not a really good standard when it comes to sex. Right? Because a lot of people do. In fact, let's look briefly at the different areas of sexuality that we've labeled deviant historically. Adultery, prostitution, premarital sex, pornography, homosexuality. Homosexuality was a diagnosis not that long ago in the broader, scheme of things. Polygamy, pedophilia, swinging, rape. Some of these are things that we should have grave concern about, right? Some of them are not. Some of them maybe aren't for me, but that's for me and how I want to live my life, and whether or not somebody else wants to live their life that way, maybe they can do it in a healthy way that I need to not have judgment about. Right? So historically, I would say that we've used the term sexual deviance in an abusive manner, if that makes sense.
Or I would even say irresponsible.
Irresponsible. I use the word abusive because there are certain populations who have been harmed by it, but definitely irresponsible. Okay. So problems with the term deviance, like we said, it's not universally accepted, and we're never going to come up with standards that are perfectly universally accepted. Sex is way too controversial, right? But we ought to get as close as we can. And it varies too much by time, by location, and it's not based on objective criteria, and people have been harmed in the past by it. So we're not off to a very good start here with sexual deviance. All right,
so we're going to talk about a couple of different terms I heard you guys throw out. Paraphilia. How many people think they know what paraphilia actually means? What do you think it means? What do you think the definition is?
It's having a attraction that is kind of outside of the norm.
Yeah. Any intense and persistent sexual interest other than sexual interest in genital stimulation or preparatory fondling with phenotypically normal, physically mature, consenting human partners. Paraphilias are not automatically a disorder. It's the disorder diagnosis comes when it's problematic to the person that has it or somebody related to them or a partner that's having problems with it. It's a paraphilia that is currently causing distress or impairment or physical harm. So examples are exhibitionistic disorder, so people like to flash you, pedophilic disorder, fetishistic disorder, and frauderistic disorder. Do you guys know what frauderism is? Yes? It's being sexually aroused by rubbing up against, just the physical kind of rubbing up against somebody clothed. So people do it in shopping malls all the time. Well, not all the time, but people who have it do it there.
So back up one slide real quick.
Yeah.
Thinking about this definition of a paraphilia, any sexual interest in anything other than genital stimulation and preparatory fondling with a phenotypically normal, adult, consenting person. So unless you're engaging in preparatory fondling to lead towards intercourse or genital stimulation, if you have anything that turns you on, other than those things with a genetically normal, adult, consenting person, then you have a paraphilia. Does anybody in this room want to go out on a ledge and raise their hand and advocate that they don't have a paraphilia? I'm not ready to do that myself. Right?
I'm not ready to do that either, but I am ready to say I don't know what phenotypically means.
Of a normal phenotype. So the shortest version, right?
Normal phenotype.
Yeah.
Sorry, I don't know.
Genetically normal. So again, I say this because we need to be really, really careful about judgment. And there's a lot of these words that we've used over time that we've come to just throw out. Oh, they've got a paraphilia, they're sexually deviant, whatever. We say them with judgment. Or even if we don't mean to, we say it in a way that people hear it with judgment. And that's not what we should be doing. Okay? Yeah.
Would masturbation be considered this since you're alone and not with another adult human?
Well, it would be genital stimulation.
I see.
So I would say
So
no.
self-stimulation is not considered, okay.
Yeah. In the field of sexual health, we've really worked a lot over the last several decades to get away from thinking of human sexuality only in terms of coupleship. Right? Certainly that's a very important realm, but it's not the only realm, and it is certainly very healthy to be outside of that realm.
But that's not with a partner, and that says partners.
Fair enough. But I wouldn't personally consider that to qualify.
Yeah.
All right, so what is a fetish? Someone, I think, said that word earlier when we were asking about deviance. Fetish is any intense sexual arousal from either the use of non-living objects or a highly specific focus on non-genital body parts as manifested by fantasies, urges, or behaviors. It becomes a disorder when it's causing clinically significant distress or impairment. So a fetish in and of itself, not a disorder and not something that we necessarily need to pathologize. And there's a lot of examples. Oh, we don't have examples of fetishes? No. Okay, so fetishes would be examples. Foot fetish. I don't know, does anybody here watch Vanderpump Rules? No? Really? Okay, well, it's a reality show. It's a guilty pleasure for me. So it's real people, and they video them, and they're like waiters and waitresses. And one of the guys on there very unapologetically says that he has a massive foot fetish. Feet turn him on. His girlfriend, he loves to play with her feet and rub her feet, and it's a sexually arousing thing for her. Is that deviant? Not really. His girlfriend is a willing participant. It seems pretty innocuous when you look at it. So it's a fetish, and it's not deviant unless it becomes problematic. What's another kind of fetish could you think of?
Objects, lots of people can have...
Balloons. There's a balloon fetish. There's actually a balloon fetish that exists. You can Google it. People can become sexually aroused by balloons. Really, literally anything. So hotel rooms. People get aroused by hotel rooms. That could be a fetish.
We've had some clients over time that had some pretty extreme food fetishes, where actually, you know, again, I don't say this to shame people. I was just give an example of you know, the many varieties that can have that engaging cooked rotisserie chickens in their sexual arousal template, right? It's way outside of my personal experience, but that's an example of a fetish that's maybe less typical.
I read a Dan Savage article years and years ago where somebody was worried that he got turned on by bread.
By bread?
Yeah, and of course Dan Savage was like, no, that's fine as long as it's not causing problems.
Well, and that happens a lot. We'll get clients who they're bothered by something that they're aroused by, but sometimes our job is to help them normalize it. It's like you come to that point where they're having a problem with it, but is it really a problem they need to get over or a problem they need to accept and normalize? And there's a very gray area there, and that's kind of a lot of the work we do with these kinds of cases. Is I had a guy who, he's a sex addict, but he also is a cross-dresser. The cross-dressing, not part of his sex addiction, had to get him, you know, abstinent from his acting out behaviors that were harmful, but down the line he may be able to incorporate cross-dressing because it's not really, but we don't know. So you had to kind of like piecemeal it, and that's kind of the fun part of our job, is never dull.
And so moving into what I think is a more helpful construct, and that is sexual health. So you can tell from what Jill was just saying that we can't give you a list of sexual behaviors that are objectively healthy, period, right? Now, I can give you a list of some things that, you know, a fairly short list of things that are pretty much always unhealthy, right? But it's a pretty short list. There's a huge range of sexual behavior that the answer is, it depends. Right? And we as a society aren't very good at doing that with sex. We're not. We want to cast judgment right away as you're doing the right thing that my mom or my Sunday school teacher or whatever taught me was what we're supposed to do, or you're in this gross bucket and therefore, you know, I don't like it and I want to call it names. Right? That's not a really good way to have a conversation. So instead of trying to decide which behaviors are good and which behaviors are bad, why don't we start with principles and apply those principles to different behaviors? And as you apply them to a given behavior with one person in one context, you might come up with one result. And the same behavior over here with another person in a different context might come with a totally different result, right? And that allows us to be objective while having flexibility and understanding what's actually happening for people. One of the things that sometimes people have an automatic reaction to and say, okay, let's shed this judgment around, whether or not it's a paraphilia right off the bat, or why would we want to abandon the term deviance? It feels like it has so much utility. I really need to be able to label certain things as bad. Well, hopefully, after a few slides here, you'll agree with me that you still get to do that. You still get to say, this is unhealthy, but I'm changing the reasons why I'm saying it. I'm being much more clear in my thought process about why it's unhealthy. Does that make sense? Okay. All right, so World Health Organization is just a starting point. It says that sexual health is a state of physical, mental, and social well-being in relation to sexuality. All of those, physical, mental, and social well-being, requiring a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. Now, buried in there are a whole bunch of principles that we can just separate out. And there are other people over time who have worked to develop principles of sexual health. Has anybody in here read the book Out of Control Sexual Behavior by Doug Braun-Harvey? It's a great book if you're interested in the subject. He's got a wonderful perspective on things. He has a list in there of sexual health principles that fairly closely align with what I'm going to share with you today. But what I'm going to share with you today is our own list that we've been working on revising over and over and over again to try and achieve greater clarity on the subject. So if we're going to have sexual health principles, if they're going to work, they need to be as universally accepted as possible. Again, like I said before, you're not going to get absolute consensus when it comes to sex. Don't expect it. But can intelligent, thinking, educated people around health look at it and agree, yes, this makes sense? We need to not have it be culturally dependent. And that is a mildly controversial thing to say, because we can come to different conclusions based on different cultures, right? Somebody's culture is a lens through which to view their behavior. But at the same time, just because rape is more normal in another culture doesn't mean that we give it a pass. Does that make sense? Okay. So we need to not change over time. We need to be based on objective criteria. Avoid any discriminating language or unintentional discrimination, as the term sexual deviance has done in the past. And it needs to steer people towards health. So this is one of my big problems with simply looking at paraphilias. And I think paraphilic disorders can be a helpful construct at some points in time. Right? You can say, is a paraphilia that's causing clinical distress? Right? That's useful. But the problem with focusing exclusively on paraphilias or terms like sexual deviance is it says what we're trying to not do. And it focuses exclusively on that. And I know for me personally, when I find that in life, when I'm running away from something, I'm in danger. I need to be running towards something. Right? That way I know where I'm going. And I think that it's really, really important, given the complexities of sexual health, that we be steering people directly towards things. And in so doing, we add clarity of what they need to be moving away from as well. Okay.
All right, so we're going to do some comparing sexually unhealthy to sexually healthy, just to kind of paint it a little bit more of a clear picture. So unhealthy, one category would be non-consenting, when you have a non-consenting partner, an unwilling partner, or a victim. So that would include coercion, being forceful, or putting a sense of obligation on that person. Healthy would be consenting. It would be volitional, collaborative, invitation. So the other person who's involved is willingly involved and consents. So one of the biggest things when people ask about what is unhealthy sex or sexual behavior is anytime there's manipulation, anytime someone is being forced or using mind tricks or whatever to get them to comply, that is not healthy. So it should never be coerced. So that is one example of consenting and non-consenting as far as sexually healthy and unhealthy.
And then briefly, to apply it more towards what you're likely to experience in your daily lives, in your own relationships. Obligation versus invitation. How many couples in America today do that really, really well, right? If my partner's not having sex with me, I'm developing resentments because I feel like they're supposed to meet my needs. Versus inviting somebody I care about into an experience that they have the free will to say no to, but I'm inviting them, right? A lot of people don't do that really well. And you don't have to have committed a sex offense or have problems with sexual compulsivity to get that one wrong, right?
Did it go up?
Next one.
Thought I did.
Okay. Exploitive versus non-exploitive. Taking advantage of, discriminating versus caring for and being equality-based. This one I tend to think more of vulnerable populations. And this is where I think for me personally, some of the more controversial things that we look at and say, is this a healthy thing for society or not? This principle adds a fair amount of clarity for me personally. So, prostitution is a really good example to look at here. Now, there's room for debate in public as to whether or not we could have a system that would be non-exploitive, right? We can have that debate, and that's perfectly healthy to have. However, let's look at what we have right now. Right now, we have vulnerable populations who are disproportionately poor, minority, with trauma history, and oftentimes with mental health and substance abuse problems. When somebody is going to if you know nothing else, and say that there's people who have that profile, and somebody is going to them and using that context of their life to be able to procure sexual contact. For me, that meets the principle of exploitation, right? And I don't have to say that with judgment about the person who's doing it. You know, they have their own demons in their life that got them there engaging in that type of behavior. But it's not healthy. That's not what healthy sexual contact looks like, procuring sex from a vulnerable person. Okay? Next one.
So, dangerous versus safe. And so I'll get to it. So dangerous would be there's physical harm, a risk of physical harm, or risk of significant disease, unwanted pregnancy, or violent. And that was the best word we could really come up with as far as violent. Because when you look at like the BDSM community, that's violent, but that's violence with consent and with well laid out boundaries. So when we talk about violent, we're talking about rape, unconsenting, illegal violence. Say physical safety, disease precaution, pregnancy planning, nonviolent. And again, the nonviolent is, why am I getting stuck on this? The nonviolent.
It's not about whether or not there's force or pain, for example, right? So in BDSM, there's a lot of times people experience arousal from pain. when we say violent here, we don't mean to pathologize that, right?
Right.
It's okay if a certain form of pain is part of your arousal template, and that's part of how you incorporate healthy sex, right?
Mm-hmm.
But when it goes to a point where there's serious risk of actual physical harm, then we're talking about something different. Does that make sense?
Okay.
Okay. All right. My favorite one. Sex negative or sex positive. So what people tend to think about when they think of sex negative or sex positive is, do you have a positive view of sexuality in general, right? Are you somebody that doesn't think it's icky and thinks it's a good thing for humans to be sexual beings? Or are you somebody that wants to shame sex and put it in a little box and never talk about it and pretend like it doesn't exist still, right? That's fair, but what I often see as being a more relevant facet of this in the clients that I work with is whether or not they have a positive or negative view of their own sexuality as a human being, right? That's a different thing. I can say sex is great and it's wonderful, and I'm glad that lots of people are out there having very rewarding, fulfilling sex in their lives. However, me as a sexual person, I'm not good enough, I'm broken, my desires aren't okay, I'm gross, right? That's sex negative. And a lot of the clients I work with, because they've hurt people or because they have aspects of their sexual behavior that might be outside of the norm, they feel very, very bad about their sexuality. So I'm going to say something controversial, and if you want to throw a tomato at me, you just wait until the end. It's very important to me when I work with a sex offender to get them to have a positive view of themselves as a sexual being. That's probably counterintuitive to a lot of people, right? Like, it kind of feels unsafe. We kind of want to get these people on lockdown, right? I want to be clear, I'm not saying that I'm asking them to embrace the pieces of their sexuality that would harm somebody. I mean, we're explicitly not doing that. We're merely pointing them towards having healthy sexual outlets and feeling positive about themselves in a way that they can be healthy people in society. When it comes to people who are engaging in destructive behaviors chronically, oftentimes this is where we lose them. If we don't point people towards a better life, a fulfilling life, then all they're left with, they still have their urges, they're still sexual people. Try and cage your sexuality. It's not an easy thing to do. And with all of those negative beliefs running around inside of their head, all that shame, it's going to come out somewhere, and it won't necessarily be by design. So we want to help them craft a healthy vision of their sexuality. And the parts of themselves that, this is where it gets messy, right? So say somebody has sexual attraction to children, right? I'm not saying that we ask them to embrace that part of themselves. That's not my point. They can say, that part of me, it's in there, it's a piece of me. I need to understand that it's there, and I need to protect people from harm. I don't want to hurt anybody. However, for the majority of individuals who have that type of attraction, that's not the totality of their sexuality, right? And the rest of their sexuality, we want to shine a light on and help them embrace and learn that they can be fulfilled. Does that make sense? Anybody got a tomato ready to throw at me?
Okay. So the next one is honesty versus dishonesty. And sexual health definitely depends on the honesty factor. So dishonest would be secretive or lying. honest, open, and truthful. And this, because we're talking about shifting from deviance into sexual health, a good example of this is, couples who choose to either be in open relationships or swinging. That can actually be a very healthy situation as long as they are communicating about every part of the contract, essentially. So they have all their boundaries in place, they're very open, they're very honest, ongoing communication, nothing is secretive about it, it's all out there. And there are some couples who choose to have an open relationship and they don't want details or they don't want to know specifics. Some of them want to know all the specifics, but I always tell people, some people who are in that kind of a culture have some of the best communication skills ever when they do it right. Because there's no secrets, there's no lying, everyone is on the same page. Some people might hear about that and think, that's just weird and not appropriate and deviant. But again, shifting the conversation, sexually healthy includes honesty, and that can be in a lot of different scenarios, different situations, not just I'm being honest about being faithful to you. It goes way beyond that.
And I would say that when I work with couples, this is where a great deal of the long-term harm to the relationship from problematic sexual behaviors comes from. A lot of spouses will tell you, I'm not a huge fan of pornography, but what really hurts is that he was lying to me every day for the last 20 years, right? That's what really hurts. And that level of chronic lying is problematic. That's not how people function in a healthy relationship. It gets confusing at times because people have different values, and you say, well, my values are here, and my wife's values are here, and I don't want to hurt her, but yes, it is confusing. And that's why sometimes people need help working through how to be healthy, right? How do I navigate this? That's fair. But just staying hidden in your spider hole, that's not viable.
Well, and there are couples, we see a lot of couples who've been married for a long time, and from the beginning of the relationship there was dishonesty because of what James is talking about, that one of the partners has certain values or certain things that arouse them, and they never ever discussed it. Had they discussed it, it could have been a completely different outcome for the relationship, but now here they are, married 20 years with kids and a life, and now they're trying to get honest and they're realizing values are butting up against each other, and it gets a little hairy. But that's why I think trying to get this out there more from the very beginning, like, you really need to be honest, you really need to talk about your fantasies, what's arousing, what your values are, what lifestyle you're looking at living from the beginning. It's hard, but it creates a much healthier relationship and a much healthier sex life.
All right, selfish versus mutual. This is the other area I would say that in our society we oftentimes get wrong. We don't necessarily even know how to do this right. So, ignoring personhood versus respectful appreciation. We're all sexual beings. We all notice attractive people. That's not bad, right? The fact that you see somebody in your mind says, a spark goes off, that's an attractive person, and even feel a little bit of pleasure looking at that attractive face, right? That's just part of who you are. The difference for me is when you separate that attractive face from it being a human being, right? And that's where we say ignoring personhood. You can notice somebody who's attractive and appreciate that and say, well, they're a human being with value and I need to not disrespect, right? But when you this is a behavior that some of the guys I work with do, find themselves going down aisles in the grocery store they don't actually need to go down because there happens to be an attractive woman that they keep wanting to get a peek at, right? more than likely they're ignoring personhood, and it's probably not their healthiest moment. But even within a relationship, sex education in this country is still broken. And people don't know how to engage in mutual pleasure with people they love, right? I say people generally, some people do obviously, but there's a chronic problem with this. And I'll just go ahead and own this one for men. I think that men are especially bad at this. Men get a lot of their ideas about what is pleasurable from things that they've seen streaming online. And it doesn't work out very well, right? I think most women who have been with a man that has those ideas would say, you know, that didn't really work out that well for me. It's really important to have sexual health, to understand the people that you're with and what works for them and what doesn't, to make it a mutually enjoyed experience.
What time is it?
We have 15.
Okay. All right, so the next one is unfulfilling versus fulfilling. Is anyone familiar with the term sexual anorexia? Meadows. So it's a term. I think Carnes coined that term, didn't he?
I think so.
So Dr. Carnes coined the term sexual anorexia. It's similar to sexual aversion. It's basically somebody who has gone from really loving sex, or a sex addict, or sexually compulsive, or sexual trauma, or whatever, and they go straight to the other end of the spectrum where they're completely turned off by sex. I guess you could call them asexual, and it's not someone who really doesn't that's actually asexual. It's someone who is aversive because of some kind of an experience that they've had, and they think that the answer is to just shut that down, to shut down their sexual personhood. So that's not healthy. If you actually have a sexual presence and you just shut it down for whatever reason it was, not necessarily healthy, because you're not living your truth. Compulsive lack of control, avoidance of emotions, those are not healthy either. So, you know, there's the debate on, is sex addiction real, and it's not a diagnosis yet. Compulsive lack of control is really what we're talking about, and there's many different labels for it, and I think we're actually going to talk about it a couple slides from now. But it's lack of control. When you are out of control, and there are consequences, and there are continued negative problems and things that come out of that, that is not healthy, and it's not fulfilling. Avoidance of emotions, not healthy. So fulfilling, enjoyment, creating joy, fulfilling erotic desires. Now, we have couples, I've seen couples who they're both perfectly okay with vanilla sex, just missionary position, that's what worked for them, nobody's complaining, and that's what's healthy. And they don't want to get into, you know, the erotic. And then there's other people who are learning to communicate. They have healthier relationships where they're talking about, I want to try this, I want to think outside the box, I want to be experimental. And it goes back to being honest in the communication. As long as you're talking about it and you're being willing, both people are on board, that's healthy. And you want to create joy. This is, again, very partner focused as well. But I guess that could be individually focused too. So, any questions about that? Yeah.
So, talking about the sexual anorexia, is there, because I hear about people who, you know, I see them on TV or whatever, and they talk about they have no sexual interest, or they're sexual, asexual.
Mm-hmm.
So is that, what is asexual? I mean, is that a healthy state?
That's a good question, and the answer is it depends.
Yeah.
Right. So it depends on what is the genesis of it, as well as is it satisfying to the individual. So some people are, you know, at a place in their life, or for one reason or another, they don't feel sexual desires, and they're okay with that, and they feel they have a rich, rewarding life, and they just don't feel like that's something that they need. I don't think we need to pathologize that, right? But at the same time, if somebody's doing it because they're trying to shut out their sexuality, or they're feeling they have really intense anxiety about sexuality. So you think about sexual aversion disorder, for example. These are people. It's not somebody who just, I'm just content. I just don't. It's not important to me. These people who actively have things that are driving them away from sex. Right? That's different. That is where we develop more concern.
If you think about anorexia, like the eating disorder anorexia, it's, we all need to eat. It's not, we need food. So anorexia with the eating disorders is aversion to food or to weight gain, or it has to do with controlling physical appearance or controlling their environment. And it's not healthy, obviously. You can sort of compare what eating disorder anorexia is and kind of translate it into sexual anorexia. It's that same. That's why it's not on the healthy spectrum.
I'm sorry. There seems to, I've heard that some people feel that they're discriminated against for being asexual.
Yeah, and some people are.
Mm-hmm.
Oh, okay. Well, because they've added it to LGBTQIA.
Yeah.
Mm-hmm.
And again, it comes down to what's really going on for that person, right? And if that is part of who they are, and I've met people who have feel that they were asexual from the time they were born, that they don't ever feel like they developed strong sexual interests, right? And that's part of who they are, and they're okay with that. We're not talking about that, right? We're talking about people who have other things going on that maybe even relate to our other principle of having a negative view of their own sexuality or sexuality in general.
Well, we see it, so an example of kind of what that would look like is, when I'm working with a partner of an addict, and they had a sex life, and she has, or he has, a sexual appetite, but because of the discovery of their partners acting out, and their partner's been seeing prostitutes and hiring escorts or having affairs or whatever, it's a traumatic experience to find that out, and then they shut down. I mean, now sex is, oh my God, I can't even look at you. Like, you disgust me. And they shut it off because it is so intrusive and so traumatic to even think about that.
And that's not a place of being content, right? That's not a person who's at a happy place saying, this is just how I want to be. Mm-hmm. They might not want to be sexual. It might be hard to even get them to be willing to look at the subject, but they're not content.
Right.
And one of the things that's confusing for a lot of people, they see people who are engaging in a lot of sexual behavior that's compulsive, that they're using as a coping mechanism. They're looking at porn for, I work with guys working on porn 10 hours a day, and seeing prostitutes and meeting for casual hookups and all this stuff all at the same time. And when an intimate partner learns of this, the human response is, well, you've been having a really good time, haven't you? Right? The reality is when we talk to these people, when we work with them, they're not. It's not fulfilling. And that's one of the things that makes it unhealthy for us based on this principle. They're engaging in a lot of behavior, but none of it's fulfilling. And they'll tell you that at the end of it, I just feel gross and sick and
guilt and shame.
Right.
They have a lot of guilt, a lot of shame, which is not fulfilling, which perpetuates the cycle because they want to medicate the guilt and the shame, and then they go to other behaviors that might be unhealthy, and then they feel guilt and shame again. It just becomes a very vicious cycle. And the anorexia piece can also happen for the guy who's, sexually compulsive or sexually addicted or whatever term you want to use. When they get into trying to learn healthy behavior, sometimes they think they just have to stop having sex completely because they don't know how to do it in a healthy way. So they swing to the other end of the spectrum. But that's not healthy. And we're not trying to teach people how to be, monks. We're trying to help them have a healthy sex life.
All right, we got 9 minutes left here. So just very briefly, human sexuality, 5 minutes. Human sexuality has professionally has some silos. So the main 3 silos here are sex offender treatment, problematic sexual behavior, and sex therapy. These are 3 different specialty areas. They don't talk to each other. They use different language, And a lot of the people in the different camps don't like each other, to tell you the truth.
Yeah.
And that's a problem. It's a huge problem because each one of these silos has really rich information to add that all of the others can learn from. And most of what we're talking about today when it comes to sexual health is coming out of the sex therapy realm. And the deviance terminology is still most prevalent in sex offender treatment. In this realm, using terms like deviance, they don't really have a whole lot of bandwidth for that. So I want to briefly share with you one model of problematic sexual behavior. It is very, very well thought out. We're short on time, so I'm going to run through this. But Eli Coleman is the head of the Human Sexuality Program at the University of Minnesota. In the sex therapy realm, he has close to demigod status. He's a very, very wonderful individual, highly nuanced in how he approaches things. So Coleman basically has looked at the literature on behavioral addictions and looked at what is different about behavioral addictions versus chemical addictions. And what we see in behavioral addictions is that things can be compulsive, like we think about, but there can also be impulsive patterns. It isn't the same, I feel an itch on a daily basis I need to scratch, right, that you think about with a classic alcoholic. Instead, you have punctuated periods of impulsivity that are still difficult to control. And this lack of control around behavior is really the hallmark. Now, how you want to think about it, there's an ongoing debate of do we put it in addictive disorders, do we put it in impulse control disorder, do we put it wherever. This kind of goes to the heart of that, is Coleman's actually arguing that we have a multi-phenomenon going on. But Coleman, it tells us, first off, that we need to be really, really careful about values in problematic sexual behavior. So if somebody is behaving outside of their values with their sexual behavior, they have a problem. We should be able to agree on that. What we should not be able to agree on is that we automatically know the nature of the problem just because they're outside of their values. If somebody's behaving outside of their values, they're at conflict with themselves. They're not in a state of harmony. It's not okay. They need to work through that one way or another. Sometimes, though, it's outside of their values because the values that was handed to them growing up that they never chose. And maybe those values actually aren't working very well for them. And maybe they actually need to think through whether or not they should adopt different values that would result in different patterns in their behavior, or even their behavior staying the same, but them feeling as though they're at peace with it. At other times, the behavior needs to change. But what Coleman says here is that we have to be really careful because when we try to apply society's values onto people, we risk pathologizing things that we shouldn't pathologize. And that takes me right back to where we started, which is the term deviance, because I think that's exactly what we're doing. We were saying that you're outside of the norm. It's not the behavior that is the norm of society, and therefore it's bad. I think we can't continue to operate with that type of a thought process. And so we think of healthy sexuality as a continuum, where on one end you have healthy behavior, on the other end you have patterns that have become impulsive or compulsive in nature and are very far outside of somebody's control. But in between you have this other kind of gray area where it's problematic but not necessarily pathological. And I give this as the final point to highlight because there's an inherent tendency to over-pathologize behavior just because it's causing any problems, right? Somebody's not necessarily here just because it's problematic. In the classic example I can give you, and we could think of hundreds if we had the time, but the classic example is a young man with raging hormones who is trying to figure out what to do with all these urges he's having all the time. I don't know a single adult male that got through adolescence without some form of problematic sexual behavior. And I don't think that they were all pathological. I think that some of them needed help working through that, and some of them were deprived of the type of mentorship that would be healthy for them to have received. But we need to think through in a much more nuanced way what's really happening for people and what care actually looks like to restore them to a healthy place. Any questions?
So one of the things that I keep coming up against is my clients who have, since I represent child molesters, pedophilia.
Yes.
I always worry that recidivism is going to be worse for my clients and they're going to have more problems because they're labeled as like monsters. And all of a sudden you've done this, you're inhuman, we no longer allow you to be part of society. How do you guys deal with that issue?
So if somebody's exclusively pedophilic, it's much, much more challenging. Exclusive pedophilia is actually very rare.
Okay.
And more often than not, it is just one facet of it. And in those cases, the way I talk to them, because I agree, I actually think it is a recidivism risk.
Yeah.
Experiencing that level of shame and feeling like you're on the outside of society, that you don't belong, you're not okay, you're a monster, you're a demon, doesn't help somebody integrate into society and develop pro-social bonds, right? And so helping them look at it differently, and I'll say to guys, you didn't choose to have this be a part of your arousal template. I've never met anybody that chose that. However, it's something that you carry and it creates responsibility. So learning to view it as something that they need to take responsibility for without shaming themselves about the fact that they have an arousal. The reality is, and I'll finish it up here because I'm out of time. The reality is that we know that the majority of people who have pedophilic attraction never act on it. They're all around you. There are people you know and love who have experienced sexual arousal to prepubescent minors. They've never touched anybody, and they probably never will. So we gotta be careful not to shame somebody just for having that piece. Okay? Thank you.